Kia ora koutou katoa. My name is Allie. I am a practice nurse at Silverdale Medical Centre in Auckland. We have around 750 diabetics in our practice. I'm here today to talk about continuous glucose monitoring in primary care. I'm sure we are all across the incredible news, the wonderful and long-awaited news that CGMs from the 1st of October will be funded for our type 1 diabetics and also for other forms of diabetes that have a similar impact to type 1 diabetes, such as our pancreatogenic diabetes. So general practice will be the main point of contact for patients to access their CGMs, with GPs applying for a special authority for these patients, and they will be collecting their CGM sensors along with their insulin at the pharmacy. There will also be wider access to insulin pumps, but this will remain the domain of secondary services at this stage. There are two brands of CGM that will be funded. We have our wonderful representatives for these two companies out in the atrium today. Please make yourself known to them if you've got any questions. They're an absolute wealth of knowledge. We have Dexcom products, which are supplied by NZMS. The ladies out there in bright green shirts, Chantal is out there, and that there'll be 3 varieties of sensor that will be available through NZMS. This is the Dexcom 1, the Dexcom G6 and G7. And then MediRay, Kevin is out in the atrium, and these products are the Freestyle Libre 2 and the brand new Freestyle Libre 3 sensor. I'm not going to go into the different types too much and who's going to get what, but I do, because I've only got the 10 minutes. But our supplier representatives are an amazing resource, and on their websites there is a wealth of information about this, as well as on the Pharmac website who's going to be eligible for what. I do want to bring your attention to a webinar this coming Tuesday, Goodfellow webinar, where endocrinologist Tom Wilkinson will be covering all things CGM that we need to know in primary care for the upcoming rollout. So I highly recommend you register for that. I've been really lucky over the last year, not just myself, but many people clinicians specialising in diabetes, to have access through MediRay to the Freestyle Libre 2. I've been able to provide a sample to patients in my practice that are using insulin. So that's type 1 and type 2. So it's really transformed the way that I've been able to assist people to manage their diabetes. So what I want to spend my 10 minutes today is just to share some of the insights gained from a clinical point of view with the use of CGM, but also from a patient point of view. So this is not only our type 1s who, it's a no-brainer, it's going to be an absolute life changer for them, and no doubt they are our priority. But for type 2 diabetics, these are powerful little feedback tools. So, we all know that, without a doubt, frequent glucose monitoring is the cornerstone of good glycemic control, but that this is really done regularly, if at all. We know that finger pricking is painful, it's intrusive, it's time consuming, it's really hard to do discreetly, and people just don't do it very, very, very much. It's not pleasant. And I really do believe that it's one of the biggest barriers to good glycemic control is what people don't know. They don't want to know, they don't know what's happening to their blood sugars. So CGM really does eliminate this barrier with the burden of finger pricking, and it just provides so much insight to be able to guide informed decision making in terms of lifestyle modification, which is massive. I'm a huge zealot for lifestyle modification for all diabetes, but particularly type 2 diabetes management, and also for us as clinicians for medication management. CGM allows us to sort of really connect the dots between the testing. what's happening over a 24-hour period. That monitoring just allows insight into how food, exercise, stress, sleep, hormones, illness, medication, how everything affects blood sugar levels. It really does allow, that cause and effect understanding for patients, which is amazing. HbA1c has its limitations. You might get several people with the same HbA1c. One of them is sitting nicely in the target time and target range. Others have wild highs and lows, which gives them that same average. Their HbA1c may look okay, but actually they're having hypos, they're having, big spikes. There is limitations to HbA1c alone. The ability to set alarms to alert for glucose that's heading into a hypoglycemic range dramatically reduces the incidence of severe hypos. And this gives the patient, that confidence and peace of mind. Hypos are a big fear, particularly for type 1s, but for type 2s on insulin or sulfonylureas as well. Readings can be shared with caregivers. So, digitally, you can have an elderly relative or a small child, and you're watching their blood sugars as well on your phone. And also, obviously, the information can be shared with healthcare professionals, with us as a team. So the ease of monitoring and the sense of control that patients experience really greatly, reduces the diabetes burnout that, as we know, often leads to people neglecting their diabetes management. So the clinical examples I'm going to use are using the Freestyle Libre 2 system, because this is the one that I've had access to for the last year, and I've worn myself and have been able to give samples to, a big number of patients in my practice. So this is the Freestyle Libre sort of interface. Dexcom data provision is very similar, albeit just a slightly different interface. So a patient will wear a sensor for a 14-day period, or with Dexcom it's around a 10-day period, and from that we can gather around 17 pages if we printed out the data from that 2 weeks, or we look at it online on our computers. About 17 pages of data can be created to give us those insights, those patterns and views, really help us interpret that data and then act on it in terms of, particularly medication management. So you can see in this example, the front page where we have time and target range. We have, I'll just up here. So you can look at, these are all the types of reports that can be drawn, and we can look at all the different patterns forming. So as an example here in the top left, this is a weekly summary. Over to the right, the program offers sort of considerations for the clinician based on patterns that are being picked up, and then down the bottom, mealtime patterns, particularly useful for type 1 diabetics, where we can sort of see if their prandial insulin is being calculated correctly. So just a couple of examples of patients that used the sample sensor. This is a really powerful example of clinical improvement for a patient. This is a young man diagnosed with type 2 on oral hypoglycemic agents. This period of monitoring really assisted him to learn how lifestyle modification could help him to get his diabetes under control. And little things as simple as in that the first fortnight that he wore it, he was doing high intensity exercise to try and get his sugars down, and this actually worked in the wrong direction for him. It was spiking his sugar. So he just learnt so much. In the first 2 weeks, he was only 19% of time in target range, with the rest in a lot higher than that. And then, here's another sample 6 weeks later where he's now 94% of time in target range. He's self-funded his sensor, but yeah, as an example, what people, the data that can be gathered. In this case, this is also this chap has type 2 diabetes, but for many years, and now is, very deficient in endogenous insulin, as evidenced by a very low C-peptide. We're trying to just, get him on the right combo. He is on a basal insulin, and he was having hypos in the early hours of the morning, but not aware of them. He was having nightmares, but he didn't actually know because he wasn't testing that he was having hypos on waking. And this was, able to be really easily sort of mitigated by moving his Lantus to the morning from the evening. And then, of course, you get that immediate feedback that we've rectified that problem. We've got a bit of work to do here with his prandial spikes, but with the ability to be able to monitor so closely like this, it gives you so much more confidence for the patient and for us in terms of being able to introduce medications and insulin with that sort of safety. And just another example of a newly diagnosed type 2 diabetic, but we did start him on Lantus. His sugars were incredibly high when he was first presented, interestingly, with balanitis, which is a very common presentation now. People coming in with very florid symptoms, so this example, he's actually continued to self-fund. Again, he won't be eligible. He's type 2, but this information for him was so motivating, this data, that he's continued to self-fund his sensors. Now he is off his insulin, he's just on some oral agents, but because during this time he has lost weight, adopted a low-carb eating lifestyle and is exercising, but just shows when he was first diagnosed, he was 3% of time in target range. His sugars were constantly, up and above 14. His average sugar here was 17. And then here we are a few months later, he's now 98% of time in target range. So yeah, it's wonderfully insightful, motivating for patients. The funding, the cost is a huge factor. And one way that I sort of suggest to my patients is, even if you can afford to do this once every 6 months, buy yourself a sensor and wear it for 2 weeks every 6 months. And just during that period of time, fine-tuning your management, seeing where you're at with your medicines, with your lifestyle, etc. So, this works out around $4.30 a week. Obviously, this is still more than can be afforded for a lot of people. And if there was any way that we were able to access some sensors for our, type 2 patients, even just to sample it, to do it once can be incredibly insightful. I'm just going to finish with a few. I canvassed a number of the patients that have worn the sensors, and some of the things that they had to say. Not having to finger prick was the most positive thing. My sugars have significantly improved with being able to set alarms, which has helped me reduce the risk of both hypos and extreme highs. I feel much more confident with my diet now. I have learnt what foods spike me. An eye-opener to learn how variable my sugars are. Instant feedback as to how certain meals and foods affect my sugars. Makes me feel like I'm in control of my diabetes, not the other way around. I like this one, extremely valuable insights. What gets measured gets done. The real-time information I could access was incredible. I could see what foods were influencing my levels. It makes me make better choices, as I didn't like seeing spikes out of the target range. So yeah, I hope that this has been insightful, and we've all got lots to learn in the next few weeks as this gets rolled out in general practice. Thank you for having me.